For someone that's been diagnosed with an L4, L5 disc bulge or an L5S1 disc bulge or a disc degeneration in the lower back or lumbar spine, or someone that's had chronic back problems, recurrent back pain, doing core exercises is a very, very important part of the rehabilitation process for strengthening the back and also for preventing recurring injury in the future. So in this video, I want to give you four advanced exercises to help strengthen the core, especially for someone that's been with a chronic low back condition or a chronic disc bulge condition like an L4, L5 disc bulge or L5S1 disc bulge. Also good for conditions like sciatica, anything that relates to the lower back area. And remember to subscribe to my channel and hit that notification bell. Hey there, it's Dr. Walter Slubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. My office is called Back to Health Chiropractic Center, and we focus on doing corrective chiropractic care. We apply corrective methods to help restore spinal alignment and postural displacements. And this helps a lot of people that have had diagnoses related to chronic back problems or chronic back pains or sciaticas or disc bulge complaints and other postural disorders and displacements related to the back and spine. And if you've seen my previous video on core strengthening exercises where I showed 4 great beginner core strengthening exercises for anyone that's had a lower back condition like a disc bulge condition, whether it's L4, L5 disc bulge or L5S1 disc bulge or even other low back conditions, things related to leg pain and sciatica and so forth. I'll put it up here in the card right there and also in the description below. In this video, what I want to give you is the second sequence to these exercises. So it's going to be 4 advanced core strengthening exercises to help strengthen and stabilize the lower back and core section. Now, why is that important? Because the core is your abdominal muscles and your lower back muscles. When they're strengthened, when they're stabilized, it can help to prevent recurring back problems in the future, recurring injuries. How does that happen? So when someone has a weak core or has a chronic back pain, a back problem or back condition, let's say you're bending forward to tie your shoelace, something very simple, or you bend forward to pick up a small little light object on the floor and you throw your back out. Well, that's the core stability part of your spine and back that wasn't able to support you properly and triggered a pain problem or a pain response or an inflammatory response or an injury in the lower back. So strengthening the core is very, very important. When it comes to core, a couple of things you need to know before I get into the exercise demonstrations is when to do them. So people get this wrong often, and sometimes it's not their fault because they're told this through their therapist or doctor to get right into core strengthening right at the beginning of treatment protocols or rehabilitation protocols. I like to start off with mobility work first and stretching as we're doing the corrective methods and chiropractic adjustments in our office. And then once we get good spinal mobility and spinal function and proper alignment of the spine and the posture as well, then we start to add the core strengthening exercises later on. So we want to begin to correct posture, frame, so your body posture, and also spinal alignment, and then we start adding the strengthening core exercises afterwards. So it's very, very important. Okay, they can be done once a day or even twice a day. If it's twice a day, it can be in the morning and afternoon or evening. If it's once a day, it can be at a time that's convenient for you, whether it's in the morning or evening. Okay, so let me get into these 4 demonstrations right now. Make sure you stay tuned till the end to watch all 4. I'm going to show full plank, I'm going to show bird dog, I'm going to show dead bug, and also squat. Very, very important exercises. So let's get started right now. Great. I hope you enjoyed that, and if you're able to follow with it. And I love to put out these kind of videos. People find them very useful. If you found this useful, please let me know in the comments below. Share this with your therapist or your doctor. See how it can be plugged into your program of care. And always do exercises with the approval or the go-ahead of your actual therapist and doctor. It's very important not to do any exercises when there's pain during the exercise or after. So being a proper candidate for exercise is very, very important. So a qualified doctor and therapist will help guide you through that. So if you enjoyed this, and if you have any questions, leave me a question in the comments below. Let me know which exercise you liked the best, whether it was a dead bug or whether it was the bird dog. And also subscribe to this channel if you're new, because I like putting out videos like this on a regular weekly basis. And when you're subscribed and you hit that notification bell, you don't miss out on the videos that I put out very regularly. This is Dr. Walter Salubro, chiropractor here in Vaughan, Ontario, Canada, and I'll see you on the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.